Thank you, everyone, for joining today's work in progress meeting. Today we have Dr. Gardner presenting. Allison Gardner is a associate professor at the School of Biology and Ecology at the University of Maine. She completed her BA in Williams College, her MS in veterinary pathobiology, MS in statistics, and PhD in entomology at the University of Illinois Urbana-Champaign, and her BS in environmental science at the London School of Economics and Political Science. Gardner's research focuses on the interaction of ecology and social drivers for vector-borne disease transmission and range expansion. She worked in disease systems including Lyme disease, West Nile virus, Zika virus, and chikungunya virus, and also has extensive experience collaborating with interdisciplinary research teams, community scientists, and federal and state agent partners. So with that, Ali, thank you for presenting today.
Well, thanks for the opportunity to speak again with the group. I'll just start the screen share really quickly. Just one moment to coordinate the logistics. Okay, here we are. Are you all able to see my screen now?
Yes.
Okay, very good. Thank you. So I've been a member of NUVEC for the past few years. I think that I know most folks here, but just to reintroduce myself briefly, I'm an associate professor in the School of Biology and Ecology at the University of Maine. I'm a medical entomologist by training, and I've been working on vector-borne disease ecology and management since my graduate studies at the University of Illinois. My lab mostly approaches vector-borne disease from a biophysical perspective. But on my first sabbatical last year, I decided to indulge my growing interest in becoming an amateur social scientist by going to school for full time. And so last year I did a one-year master's program in behavior science at the London School of Economics. And It was a really interesting and gratifying experience that really stemmed from my desire to start placing my biophysical research in vector-borne disease into more of a social context. And so I'm going to spend some time this morning, just talking about the research that I did while I was on my sabbatical at the LSE. It is not research that's, funded directly by NUVEC, but I'm hoping that it's going to be of interest to this group, since we all have a shared interest, not only in developing new public health approaches for tick-borne disease, but also in thinking about how our scientific findings are adopted by individuals and by communities. And so, yeah, that's what we're going to focus on. This is a bit of a reprise from a talk that I gave at the Trot Med meeting a few weeks ago. And so some of you who are in attendance at the meeting already have seen this, but since we've got the longer time here, I'm going to talk about some of the details of the work in a little bit more depth. And then, as my understanding of these meetings, the goal is to be able to get feedback and discuss future directions on ongoing work. I'm leaving some time at the end. Sorry, I'm getting distracted by everyone trying to come through the waiting room. I'm going to leave some time at the end. I think I'm going to speak for about half an hour, and then I'll leave some time at the end for open discussion. I'm hoping that folks in the room are going to have their own takes on this entire research avenue and directions that could be pursued in the future, hopefully collaboratively. So that's a little, setting the stage. And I do want to start off by acknowledging my colleagues who were involved in this research, Ganga Sridhar and Anamitra Chatterjee. They were the two people who I worked with, two faculty members at the London School of Economics who I worked with on this project. They're both environmental economists by training, and so it was really interesting to me getting a chance to learn about, theory and tools and data analysis from the perspective of a discipline that was largely new to me over the past year. And so you will see kind of their influence woven all throughout the work that I'm going to show. So I want to start us off here. Again, just setting the stage. This is all familiar to most of us as tick-borne disease researchers, but I wasn't sure exactly who the audience would be today, so I'm starting at the base level and working our way up. So my research focuses on management of Lyme disease, which we recognize as the most important tick-borne zoonotic disease in North America. I'll start off as I usually do with my talks, just by showing some human case data to situate where we're coming from. So here we're looking at a map of the number of Lyme disease cases per US state in 1992, which is the year that Lyme disease first became a notifiable disease. And then here we are 25 years later in 2017. I think we all are familiar that the number of reported cases has exploded during this time. It's multiplied by 4, especially here in the Northeast, the region that we're all particularly concerned with. And of course, these number of human cases likely represent, somewhere near a tenfold underestimate of the total number of human cases. These are just the cases that are being reported to the CDC. And so we know that this is a really substantial problem. And clearly this increase in human cases that we've seen over the past 30, 40 years is not for a lack of trying to control Lyme disease. There's been an enormous amount of research to that end. But the system, we all know, is incredibly challenging to manage, in large part due to the complex life cycle of the black-legged tick. They've got the 2-year life cycle here in Maine. The larvae tend to emerge in late summer, like around August. They molt, they overwinter in the nymph stage. They're active here in Maine around July. In many other states, the nymphs start to appear earlier in the season. And then we've got our peak of adults here around October, November. I think we're still in the peak of adults here. We've had a pretty mild winter, and we're still going out and finding ticks, even though we just saw our first snow here during the past week. And so we know that ticks interact with different hosts throughout their life cycle. I think that, for the most part, we accept that during the juvenile stages, the ticks are typically parasitizing small mammals, maybe birds as well. Often these species are competent reservoir hosts for a variety of tick-borne pathogens we're concerned with. And then during the latter half of the life cycle, that's when we see the ticks parasitizing larger animals, deer, dogs, people, and a lot of the spread of tick-borne disease. And so, for the most part, public health strategies, public health researchers, entomologists, disease ecologists have been devising different Lyme disease management strategies that are centered on disrupting some stage of the tick life cycle or the pathogen transmission cycle. And a lot of these strategies historically have centered around personal protective behaviors. So things like using insect repellents or wearing long pants while you're recreating outdoors, or performing a tick check after you come in from spending time in the woods. But clearly, these strategies have fallen somewhat short as our primary defense against Lyme disease. We continue to see that number of ballooning cases in humans, despite our best efforts in public health to educate people about how to execute personal protective behaviors. And Lars showed me just a couple weeks ago an interesting study. I think this one was the one that was conducted in Germany that's going to be appearing in Ticks and Tick-Borne Diseases early in 2025, where they documented and visualized pretty well that even if people are aware of what personal protective behaviors are likely to be effective, they're often very unwilling or unable to engage in these behaviors for whatever reason. So personal protective behaviors do seem to be falling a bit short because people don't actually engage in these behaviors as much as we'd like. I think that that's a focus of one of the inner COE groups that I'm involved in, focused on tick bite prevention. Another limitation on using personal protective behaviors is like the sole line of defense against tick-borne pathogen transmission is that these behaviors, they don't actually reduce the density of infected ticks and pathogen transmission in the environment. They do disrupt transmission of tick-borne pathogens directly to humans. These strategies are all centered around preventing tick-human encounter frequencies, but they're not going to serve kind of the public good in the sense of reducing density of infected ticks on the landscape. Now, there are other strategies that do hold the potential to reduce the density of infected nymphs, and also can be operationalized by municipalities rather than by individuals. And so they might have the potential to lead to tick reductions in tick-borne disease transmission prevention on larger spatial scales. Some of the ones that have been considered and well studied, many of the leaders in studying these approaches are here in the room, include insecticide application. So the idea here is that we're going to target the vector directly and eliminate the vector directly in the environment through insecticide spraying and a wide variety of different types of insecticides under consideration for this purpose. Deer culling is another strategy that might be viable, or other types of deer management for that matter, as a means to control ticks on the landscape. And then invasive plant removal also has recently come under a lot of discussion as a tactic to manage ticks. The theory is that invasive plants provide really good habitat, both for ticks and their hosts. And so if you remove invasive plants, there are a number of studies that have been conducted down in Connecticut. A lot of the work has been done, and also in other areas of the Midwest and the Northeast, suggesting that removing invasive plants can appreciably reduce the density of ticks that we see in the environment. And so there are these strategies that are out there. And I would argue that these tactics might be especially useful on public land. We know that public land is one of the major areas where people get exposed to ticks. So I'm just highlighting here briefly the meta-analysis out of Rick Osfeld's group that came out in 2019, where they analyzed prior studies to try to determine where tick-human encounters are likely to take place. And despite a lot of research that's been conducted that's focused on residential tick control, what the authors found in this study that tried to aggregate the findings of a lot of different prior work, they found that it may not necessarily be the yard that's necessarily the particularly high tick encounter risk area for humans, but rather the neighborhood beyond the yard. And tick encounter frequencies are likely to take place, close to where people live still, but perhaps on public land rather than on privately owned land. So public land has really high epidemiological relevance, but individuals are certainly not managing it. And so this is a situation where potentially bringing these strategies into play could be very valuable for benefiting entire communities and reducing entire communities' risk of exposure to tick-borne disease through larger scale management tactics. The problem is there are a lot of obstacles to implementing these strategies, and I'm going to put the obstacles into three major categories here. The first category is scientific uncertainty about the efficacy of the strategies. I think we all are familiar that there's a lot of conflict between studies and within the scientific community around how well these strategies actually work. There's a certain amount of doubt as to how effective they are at actually accomplishing the goals, both of reducing the number of ticks on the environment and perhaps even more importantly, reducing the human case burden of Lyme disease. So like this study, for example, was a meta-analysis that came out a few years ago on will culling white-tailed deer prevent Lyme disease? The answer isn't, quite as straightforward as one might assume. At different spatial scales, it can be very difficult to tie direct links between removal of deer and reduction of ticks, or reduction in human cases. Similarly, there have been these two large-scale studies recently that I think most of us will be familiar with that focused on residential tick control and the capacity of residential tick control efforts to prevent Lyme disease in humans. So again, we've got Rick and Felicia's study down in New York where they tested, the use of bait boxes coupled with Met 52, which I guess since has been pulled, but they're working with entomopathogenic fungi to see whether a combination of these tactics can reduce tick densities and then also reduce human cases of Lyme disease. And then we had Allison Hinckley's study as well, which many of members of our group participated in some fashion, where they were testing residential acaricides to prevent Lyme and other tick-borne disease in humans. A lot of these studies have found that even if these tactics do successfully reduce density of ticks on residential properties, this doesn't translate to decreases overall in the incidence of Lyme disease in humans. And so there's doubt about whether these tactics actually are going to work. It's not an uncommon information environment to be in at all in public health or with a lot of, kind of contemporary scientific problems. I think about like PFAS as well and harmful algal blooms. Like there's a lot of situations where there's scientific uncertainty about how best to respond to a situation. While at the same time, like we really have to respond to the situation because the situation is going on now. But uncertainty can be a major obstacle to implementing these larger scale tick control strategies in a public health context. Another issue is negative externalities. So there are a lot of reasons that have nothing to do with ticks that people might dislike certain types of potential tick control strategies. So for example, many people don't like the idea of spraying pesticides out into the environment because they're concerned about non-target effects on pollinators, or they're concerned about introducing PFAS into the environment, which is another major public health concern that we're dealing with simultaneously. Similarly, there are a number of strategies that, potentially like four-poster devices that involve aggregating deer in close proximity to each other that might lead to the spread of chronic wasting disease. And so in some cases, the solution to one problem potentially exacerbates another problem. And this can be a barrier to how we implement tick control. And then another obstacle is cost. I saw Dr. Burtis is on the call now. I read his paper earlier this year with great interest. It was kind of fortuitous timing while I was working on my research, which I'll take you through in just a few moments. He was working on his survey of the vector control districts and public health agencies in the US about what types of activities their agencies currently do in the context of vector-borne disease control, and what would they like to do, and what are the barriers to doing them in the future. So just to borrow a few bits of data from his study in parasites and vectors, he asked, does your agency take direct action to control vector populations? All of them did. The vast majority were involved in mosquito control, but they weren't involved in tick control. Less than 20% of agencies that participated were engaged in any form of tick control at all. But this wasn't for a lack of desire to do so. The question was asked as part of this study, if resources, funding, training were available, would your agency be interested in suppressing ticks using acaricides, habitat and landscape management, and deer-targeted interventions? Yes or no. And a lot of agencies, 70%, did express an interest in using acaricides. Roughly half expressed an interest in engaging in some sort of habitat management. Slightly less than half expressed an interest in engaging in deer-targeted interventions if resources were available. But of course, resources was the major barrier. The question was posed again in this study, how much would you need to increase your budget to incorporate suppression of tick populations on public properties into your services? And the answer was, on average, a 43% budget increase in the annual program budget was going to be needed to actually pay for this. And so, a major question arises is, how are we going to do that? And so, in this kind of very complex information setting where we've got various environmental and public health trade-offs, and potentially low information at play as well, the two questions that I was interested in as part of my research project last year were, first, how does residents' willingness to pay a tax for tick control programs on public land vary with the tick control methods that these programs encompass, as well as the quality of evidence for the efficacy of the program that comes from science? And then second, what are some of the key factors in individuals' own experiences, their psychological drivers of preferences and willingness to pay? And so I'm going to take you through the study. This was an online study that was conducted in Qualtrics in May 2024. We had 600 respondents to the study, and they were recruited through Prolific, which is a market research company. And the study population was limited to adults over the age of 18 in the 10 high Lyme disease incident states in the Northeast. And so the survey instrument comprised three sections. The first section was designed to evaluate people's a priori Lyme disease knowledge and attitudes. And so this part of the survey instrument was grounded in the health belief model. There are many experts in the health belief model who are attending the call this morning, and I'm looking forward to hearing your perspective on this as well at the end. But basically, the logic, the health belief model is a social cognitive model that's designed to describe and explain the likelihood of an individual engaging in a health behavior, especially a preventative health behavior. And so a lot of historical research using the health belief model has concentrated on things like likelihood of getting vaccinated or cancer screenings or condom use or something to that effect. It has been extended to the context of engaging in personal protective behaviors against tick-borne disease as well. But to my knowledge, this is the first study that's been done where we try to apply the health belief model to willingness to pay a tax related to vector control. And so the likelihood of engaging in a health behavior is described as a function of a few different factors. First, the perceived threat of the health condition. So how severe does an individual believe the health condition is if they're exposed to it? And then also how susceptible do they believe that they personally are to the health threat? As well as the evaluation of the behavior. So when you're considering engaging in a certain type of health behavior, what do you see as the perceived benefits of the behavior? What do you see as the perceived barriers to engaging in the behavior? In the case of my study, I also started to incorporate like how effective do you believe the method is going to be, which is kind of encompassed a bit in both benefits and barriers. And then health belief model also typically encompasses a variety of modifying factors like demographic variables, people's knowledge and personal experience of the health condition. I also incorporated some psychological characteristics in the model ultimately. So we had survey questions to address each of these points and kind of how the participants were situated with respect to Lyme disease coming into the study. The second component of the instrument was a willingness to pay discrete choice experiment. And I'm going to walk you through how this works. Discrete choice experiments are a stated preference technique that comes out of the field of behavioral economics that's designed to address a policy question that's multidimensional in some fashion. So that means it has multiple component attributes, each of which might possess distinct valuations. And I'll show you on the next slide how this works in the context of this study of tick-borne disease. So the way that this section of the study was laid out, this was the experiment. Each respondent faced 8 choice sets of tick control programs, and they were asked, would you most prefer to pay for option 1, option 2, or there was a status quo or like do nothing option if they're unwilling to pay for either of these programs. And each of the tick control programs that were presented in the study varied 5 attributes. So this is a summary of the attributes in the study. 3 of the attributes concerned what types of tick control tactics are being incorporated as part of the vector control program. And it could be anywhere from 1 to 3 tactics, because in IPM, it's very common to combine multiple strategies simultaneously. So did the control program incorporate insecticide application, deer culling, or invasive plant removal? Yes or no on each. And then we also included as our measure of, our indicator of likely efficacy of the program, we included one of 3 quality of evidence indicators. And these were adapted from similar work that was done in the context of COVID over the past few years. First, the quality of evidence for the efficacy of this program is fairly certain. Second, it's uncertain because there's a lack of data. Or third, it's uncertain because there's disagreement among experts. And the reason why we had all of these different categories is because prior work has found that people respond differently to lack of data versus disagreement among experts in different contexts. So we try to incorporate this into into the study design. And then finally, the last attribute for the discrete choice experiment was the cost. So a tax, an increase to an annual property tax for tick control. I estimated values for this based on the typical kind of mosquito abatement taxes that people are paying, as well as just some expert elicitation with people working on vector control in the Northeast. And so this is an example of one of the choice sets that a participant would face. We've got our first program. It has insecticide spraying. It costs $200. The quality of evidence is fairly certain. Then we've got our program 2, which encompasses both deer culling and invasive plant removal. This costs only $50. The quality of evidence is uncertain because there's disagreement among experts, or if they don't want to pay for either option, they can select none. And we put each participant through 8 different scenarios. And this study was done in a fractional factorial design. So like, and it was done in blocks. And so different blocks of participants face different choice scenarios. And so we were able to estimate, the effect of the individual participant as a random effect when we analyzed the data, as well as use this design to estimate the marginal willingness to pay for each of the policy attributes in the experiment in turn. And then finally, the last section of the instrument was designed to assess other moderating individual factors that we believed a priori might be linked to people's willingness to pay or their feelings about certain control tactics. So we included from the Schwartz Value Survey, people's measures of people's biospheric and altruistic environmental values, their risk and ambiguity aversion, as well as demographic variables like gender, age, education, and income. So we analyzed these data using mixed logic models, and I'm going to walk you through 3 models that we did. They're going to build in complexity as we go. So the first model we're looking at is just the model that contains the basic policy attributes, no covariates. And so this is going to show us like which of those attributes are people actually willing to pay for. And what we found here was that the respondents were willing to pay for strategies that encompass invasive plant removal or insecticide application. But in this study, they were not willing to pay for deer culling. And so this was an interesting result. Also interesting, the most important feature of the preferred tick control programs was that the quality of scientific evidence for their efficacy was fairly certain. And again, this is just a reminder here of what these indicators were of scientific efficacy. What we take away from this is that more than people care about what exactly are the tactics involved, they care that it's going to work. If people are putting their resources and their money into something, they want to know that it's going to be effective at reducing the density of ticks in the environment and their personal Lyme disease exposure risk. And this is also reflected in our marginal willingness to pay estimates. You can see here that people were on average willing to pay $135 for invasive plant removal, about $50 for insecticide application. Again, this is on public land near to their home is how this was positioned. But they're not willing to pay for strategies that involve deer culling, and they are especially averse to strategies that are unproven in their view in the scientific literature through a lack of data or disagreement among experts. There was not a statistically significant difference between those two. The next model that we look at, we start to try to predict. We identify factors that are predictive of people's willingness to pay using the constructs from the health belief model. So what we found here was interesting as well. Perceived benefits of and barriers to control methods was the strongest predictor of willingness to pay. So this is respondents' a priori views of control tactics before we show them the indicators of scientific efficacy as part of the discrete choice experiment. So if people have very favorable views of each tactic individually, makes sense, they're more likely to be willing to pay for those tactics. We also found that high Lyme disease personal experience and perceived susceptibility were predictive of willingness to pay for any tick control program. So this was an interesting observation, and it seems to make sense that if people feel closer to a threat in some fashion, they're more likely to be willing to invest their resources in preventing that threat. We did also find that high Lyme disease knowledge was not predictive of willingness to pay for tick control. And we'll talk a little about the implications of this as we move through the slides. And so this is kind of what we take away from the health belief model constructs. And then finally, the third model that I'm going to show takes into account the other moderators of preference heterogeneity. So again, these are the factors that we thought a priori might be linked to willingness to pay for tick control on public land. And we found some interesting interactions here as well. Higher risk aversion generally was correlated with higher willingness to pay. And so in thinking about how to interpret this, my thinking is that if people are more risk averse, they might be more concerned about health conditions broadly posed. And so they're more willing to pay for a strategy that's going to mitigate that threat. But this was not the case if the quality of evidence was low. If the quality of evidence was low, then this relationship actually flipped, and more risk-averse people were less likely to be willing to pay. And so here, I think that the risk aversion can be kind of manifesting in how people are willing to invest their financial resources. They might not be willing to take the risk of investing their money in an unproven strategy. We also found that stronger environmental values generally were correlated with lower willingness to pay. And to me, that made sense as well. People who have stronger environmental values might be less willing to spray insecticides in the environment or kill wildlife in the course of trying to prevent a health condition, except again for invasive plant removal. People with strong environmental values were much more willing to pay for invasive plant removal compared to those who did not have strong environmental values. And we think that that's because people saw the synergy there, the potential to deal with the environmental problem posed by invasive plants while simultaneously dealing with the health threat posed by ticks. They're more likely to be willing to pay. And we also found that demographic factors didn't affect willingness to pay at all, which was a bit of a surprise to me. So just to sum up and give like my concluding thoughts on this, and then I'm really looking forward to the discussion with the group. I think that our study does show, first of all, that property taxes could be a viable mechanism to support tick control on public land. There was high willingness to pay for programs overall. And I think that this is a really interesting and meaningful observation because, again, going back to Dr. Burtis's study, one of the principal barriers that public health districts seem to see to operationalizing tick control as part of their services is simply how are we going to pay for this? And so if people are willing to pay property taxes for tick control, this could potentially point to a viable mechanism for delivering the tick suppression services. The perceived benefits and barriers to control methods, again, were a major driver of willingness to pay, especially if the methods align to residents' environmental values. And this is an area where I think that future research could consider control methods in more detail. The question that I always get asked when I talk about this work with biologists is like, what type of insecticides were you proposing to use? Was it like biorational or was it conventional insecticides? How do people feel about things like bait boxes, deer relocation, four-poster devices, deer culling? There's like a lot of nuance to this that we see as biologists to these different control strategies. When I was talking to my master's advisor about this, she was just constantly telling me, don't, leave room for scope creep. Keep this simple, get people's general attitudes, and then this can point to future research directions that can be studied in more detail. And so in the next phase of the work, in whatever form it takes, I think it's necessary to consider this in greater depth because you can imagine, and we all know from our professional experiences, people tend to have very different views about deer relocation versus deer culling, or even how the cull is being accomplished by hunters, by sharpshooters, what have you. People have different attitudes about invasive plant removal, depending on if it's going to be chemical removal or mechanical removal. And so I think that it would be nice to be able to get to grips more with how people see the nuances of all of the different approaches. We found that factors that reduce psychological distance to Lyme disease, like personal experience and perceived susceptibility, increase willingness to pay. And this was not surprising. In general, people are more likely to act on a threat that they feel is more immediate in a lot of different scenarios, not only confined to health. But I think there's a question here as to how we incorporate this observation into our public health messaging and practice. And there's a bit of a fine balance here because how do you elevate and make salient the concern about Lyme disease in people's minds such that they're going to act on it while not taking it a step too far and actually discouraging people from spending time in the outdoors at all, by instilling too much fear of a health condition. Not spending time outdoors, of course, is a bad thing for a really wide range of reasons. And so there's a bit of a fine balance here, but I think that there might be room for some like interventions in the Lyme disease system that are geared more toward raising the salience of the issue in people's communities. So I'm very interested in people's perspectives on this, especially those with more of a public health background than I. We found that knowledge was not associated with willingness to pay, which I thought was an interesting observation because a lot of our current behavioral interventions are knowledge-based interventions where we try to educate people about tick-borne disease. We try to educate people about personal protective behaviors or any number of these strategies. And then we hope that that leads to greater adoption. But in a lot of systems, knowledge has not been shown to lead to changes in behavior, which is, I guess, a little bit sad on some level. But nevertheless, it's something that we need to work with as professionals. And so this is another kind of interesting insight that comes from the study. And then finally, we found that scientific uncertainty really reduced willingness to pay, although the effect of uncertainty did interact strongly with risk aversion. And I think that that poses a communication challenge for us as biophysical scientists. And again, we've got a lot of people in this group who are really focused on and devoted to this issue. How do we, teach people and honestly and transparently communicate the uncertainty that we experience within the scientific community as the knowledge base evolves, while still empowering people to make decisions on real health issues that they're facing in real time. And I think we saw this a lot in the context of COVID. It did feel a little bit like, there's a lot of mixed messaging going on, like you should be wearing a mask, you should be not wearing a mask, you should be wearing a certain type of mask, you should be wearing two masks. It felt a lot to the public that, that we're kind of getting yanked around a bit in terms of the advice. We who know the scientific method know that that's because knowledge evolves. But I think that in these information environments where people are getting like very mixed signals about the efficacy of strategies, and in many cases it's because there is genuine uncertainty within the scientific community, how do we communicate this? How do we enable people to make positive decisions for themselves and their communities while also, being transparent and open about the limitations on what our current understanding is. So that is what I've got in terms of the slides. We've got about 20 minutes remaining, and so I'm hoping that we'll be able to have some open conversation and some feedback on this. I'm going to close the screen share just so I can see everyone's faces. But I'm really interested in your thoughts about avenues for future work, what you see as kind of strengths and limitations on this. I am moving toward trying to publish this work now, and I'm exploring what the future research directions might look like. But thanks for your attention.
Thank you, Ali. Yes, we'll open it up to questions. Feel free to unmute or raise your hand with the little emoji.
Hi, Allie. Great presentation. This is really good information. It's something we've kind of been mulling over too, we've identified this potential way to potentially control ticks, but how much are people actually willing to pay for it?
Yeah.
Just to add, so we actually have a follow-up survey. We're working on getting it out right now. But we've kind of added another roadblock here, where we've surveyed public health. We've surveyed public land managers to try to determine what tick control methods they would actually allow to be used on their property, and we're
Yep.
hitting an additional roadblock here where it's very limited, where we can actually deploy acaricides or a deer targeted method, and habitat management seems to be the most viable option moving forward, just
Yeah.
as a regulatory issue. But this is another component we're kind of struggling with, is how to actually get this out in the field, even if we can pay for it. We have to find places where it can be deployed, and we're also working on a second. This is a little slower. It's a follow-up to a paper that came out recently from New Jersey, where they looked at the cost of tick control implementation. And we're trying to scale it up to more of a county level to see what these things would actually cost. So it's really great you have those actual values for property tax, because maybe we can connect that to get some idea of just what what it would cost to actually do tick control on public land at a larger scale, and where we can actually get these things deployed. I just wanted to kind of add that context a little bit.
Yeah, that's great. And I'd be really interested if you'd be willing to have like a separate conversation about this at some point. I'm really interested in discussing it because a lot of my other work that I've been doing here in Maine has been with managers of land, some of it private land and some of it public land. And we've also been, interested in the question of how and where some of these strategies can get operationalized. And Maine has been like a very interesting scenario in particular to work with that I don't think it's necessarily representative of the entire country, because here we've got a lot of public access to private land as well as part of kind of the culture of the state. And we have a massive amount of private land ownership. And so we've been concerned with, in that kind of epidemiological setting, like what makes private landowners interested in adopting management practices as well. So I'm really interested in the work, and I will say as well, I agree that getting like the real cost estimates for this is the single greatest challenge that I was dealing with in doing the work. I talked to people about what they thought, it might be, except getting people's opinions on this, of course, is like a very different matter from the kind of like brass tacks that you're talking about. And so I'm interested to hear how that goes. And I found it very fortuitous. I wasn't even aware of the work that you guys were doing while I was putting together this study. And when I saw the parasites and vectors paper come out, like roughly around the same time that I'm starting to write this up, I was at the very least relieved to see that a lot of the same kind of management tactics that I was considering were the ones that seem to be on the table from the CDC perspective as well. So yeah.
Yeah, and your survey is something we've been discussing, trying to pursue at some point anyway. So this is
Yeah, no,
excellent
it's
synergy
awesome.
here.
Yeah, no, it's great. And I'd love to talk about it more. Yeah, I've
Yeah,
been
we
really
can definitely touch base
amazing.
separately at some point.
Yeah, Andrew.
Well, first of all, really, really fun data. So it's exciting to force people to really put their preferences into quantitative terms. One question is the $0 to $200 range.
Mm-hmm.
Is there
Yeah.
any worry that doesn't capture the like realistic, I don't know, like in terms of where people's preferences may not be captured in that? It's kind of a question, but
so are you suggesting like if the range should go higher, would people's preferences be manifested differently, or
potentially, or if it wasn't, so they had to choose between the $4
yeah,
values, or could they
so
do
those
something?
4 values were attributes of the program. It wasn't like we thought about whether to do like a contingent valuation
Slider.
experiment, which is where you just directly elicit like what would people be willing to pay for this.
And then
But we went with the DCE because that really enables like kind of the separate valuations of the different components in a way that contingent valuation can't capture as directly. Yeah. There are limitations on the DCEs for sure. First is the constraint is the a priori values that we come up with for those tax estimates, and how realistic are they, which I think is something that is definitely up for debate. I mainly developed them from the context of mosquito abatement, which is very different from tick control. But yeah, there's all kinds of questions about, like how people respond in an experiment versus how they'd respond in reality.
Yeah, I mean, it's very different to respond to a survey versus like
Yeah.
writing it.
Yeah. But we attempt to capture it as best we can. Mm-hmm.
Yeah, the only reason I asked you, I was just a little bit surprised to see that the income wasn't associated with it.
I was surprised too. Yeah. And there was quite a distribution on the income as well. Mm-hmm.
So from the survey marketing company for the sample frame, was there good coverage of socioeconomic status, presumably since it was commercial?
Yeah, I mean, there is some bias in it because it's an internet survey. And so necessarily we're capturing people who have internet access. And like I know in Maine, for example, there's like huge parts of the states that are off the grid. Maine is actually regarded as one of the states where internet surveys are not a viable way of capturing a representative sample. But that being said, it was done through a market research company. We did get a quote unquote representative sample for the region. But yes, there are definitely demographics that are not captured through internet surveys necessarily. And this was an above average, highly educated population, which also tends to be a bias with these types of samples.
Sure. Okay. But no, I mean, it's great to see
Yeah.
actual numbers in terms of people's preferences. And then there's more just a random aside about
Yeah.
trying to convey nuances. I think all through public health messaging, nuances are essentially impossible. So
Yeah.
maybe that's kind of like the core problem we're all to design like an ideal tick control program is going to require the average consumer to understand a lot of nuance. But that was a hard battle. So
I
maybe,
think nuance is a hard battle in all areas of American society. Yeah.
yeah. And so maybe that's like the meta issue to all of this is like, even if we figure out all of the ideal pathways, how in the world do we message it? And I obviously don't have answers, but just to get us all thinking about it.
Yeah. Yeah. Thanks for your comments. Nell?
Great presentation, Allie. It's great to see this work come to fruition and see some of the results. I think it's really also very interesting. You know, we did these long form, hour-long interviews with homeowners and seeing that the results are really reflective of what we're hearing people say. And those are
awesome.
Some of the most invested people because they've been in the itch protocol for a year or two, but still seeing the same issues around, you know, uncertainty and wanting really to know what is the efficacy of these things. And it's also such an interesting landscape where uncertainty is not like we have an estimate and there's a, you know, some very estimate. It's like it might or might not work at all. And the range is like 0 to 1. So that's a really difficult uncertainty environment, but people do have to make decisions. I was wondering if you considered, because you have these two kind of categories of like fairly certain and then uncertain. So it really was a binary. If there was any gradation to the certainty that you consider.
Yeah, so there wasn't in this study. And the reason why is because one thing I learned about discrete choice experiments is that if you create too many levels, you won't get as good data because people will start using heuristics to answer the questions, or they'll just like click through based on a single factor and basically become single issue choosers. And so it's a limitation on the methodology, right? But I agree that these are very stark differences that were being posed as just as part of the experimental design. The specific messages were adapted from a study that was conducted in the context of COVID. And so there is like kind of a basis for the language that we chose. It wasn't something that I invented for this study. But that being said, I agree. I think so. This is something that to me would be better addressed through a frame other than the choice experiment model. Potentially the qualitative research as well has a place in all of this. But I feel like my research program for the next 10 years has kind of been motivated by some of what we're seeing here and the nuances to how that uncertainty is conveyed and the range of kind of the spread of uncertainty, I think is a major question. Yeah. You hit the nail on the head. Yeah.
And then, well, I mean, I'm obsessed with these questions also. So.
Yeah, I know. Yes, I know well.
I think one thing I want to also offer is maybe that we can connect you also with the disease decision analysis research group at USGS, because I feel like another path forward also is using the adaptive structured decision-making landscape and having, you know, that there are sort of, you can move through that landscape where there's like maladaptive conditions and adaptive conditions to make these.
I love that. Yeah. And you know that I went to the workshop in West Virginia. That was a week before my sabbatical. And I was having some real doubts as to whether I should be going to West Virginia like days before I'm going to England for a year. But I decided to do it because I knew that I was interested in this research area already. And I thought this is really going to get my head in the right place. And now I'm thinking back on that workshop after having spent the year on this in just a completely different light, I do see how they can be complementary with each other. And I would love to talk with you more about this because I've been thinking all year that some of what I've been working on, it's approaching like similar fundamental questions that you're working on, but through a slightly different lens. And I'd love to see how it can connect together.
Totally, hard agree. And I don't want to monopolize the time, but I also just want to mention it might be really. Well, we can touch base afterwards. I'll just leave it there because I have several other thoughts.
Amazing. Thank you. I saw Nita's hand earlier.
Yeah, and unfortunately, I'm sorry, I have to run
Yeah,
to
no worries.
another meeting. I was just typing in the chat that I'll follow up, but I thank you so much for
Great.
that talk. I have lots of questions that I would love to talk to you offline anyway about, but
Thank
thank
you
you.
so much.
All right, sorry
Yeah.
to run.
If there's not another question, I'll just ask really quickly if you think that, and I know you didn't study this, but one thought that I had immediately is that if there was a tax, that it might actually influence whether people take management actions personally in their own yards.
Yeah, I've wondered that too. It's kind of a behavioral spillover effect that like once you're investing money in something like through a tax, it might change how you behave on the individual basis. And I think that that's interesting. I wonder if even the discussion of the tax in the community could lead to changes in individual behavior. I've wondered if the tax might make the issue just more salient to people and decrease the psychological distance. Like if it's the public health district thinks that our problem is bad enough, we need to pay a tax to try to control this. Is that going to kind of lead to a change in behavior as well? It's a lot of a whole can of worms. Yeah. Lars.
Yeah, hey, thanks, Ali. That was really fun. I was just wanted to touch on one thing that you talked about a bit that's been bothering me quite a bit for a while now. Just the spatial disconnect between the treatment area where you're impacting tick density and the
Yes.
human activity space. And
Yes.
it's so dependent on the method. Like the Hinckley study was ecotone spraying on property,
Yeah.
which is that ecotone of your property is a very, very small portion of your activity space. And then Rick's study was still focused on residential properties, but with debate boxes trying to get the whole property, but then you have the neighborhood exposure.
Yeah.
So in the sense of when you think about public lands, you would, if you're talking about vegetation management or a acaricide spraying, you would be protecting very small
Yes.
portions of the pulp. But then you sort of seems to me you have to get to there to get the landscape effect over. So
Yeah.
I was just wondering in terms of if you had any thoughts about how people when people hear the notion of protecting public lands. Do they
Yeah.
think that they will be protected regardless of where they go on the public land, or do they understand that it may only be the yard on each side of a portion of a trail that's actually protected?
Yeah. So this is actually something I've spoken about with the National Park Service. So I've been working on tick-borne disease in Acadia as well, which is our national park about 75 miles away from here, or 75-minute drive, excuse me, not 75 miles. And like they've been interested, so like they're not going to spray insecticides all over the place because they're a national park, but they are very interested in the vegetation management strategies. And so one of the things that we've been talking about with them is how you could kind of dual package and sell together policies like leave no trace and stay on the trail messages with tick control. So like you can't control vegetation throughout the entire park in all likelihood, but you can control vegetation like near the walking trail, which is where you want people to be anyway. Like people who depart the trail are causing all kinds of ecological impacts that the National Park Service wants to see. And so one thing that they were interested in doing is looking at, two behaviors we want people to engage in. Like we want them to be protected against ticks and we want them to stay on the trail. Is there any way we can couple them in the messaging by saying things like, we are controlling ticks near the trail, don't leave the trail? And will that increase the likelihood of them not getting exposed to ticks and staying on the trail simultaneously? And so I think that something like that could be interesting for other types of public land as well. It's like a kind of rare nature conservancy that wants people wandering around off trail. And so I wonder about like the feasibility of kind of like dual packaging of the two issues and whether that could help, in the case of the landscape management strategies, especially. But I agree that the disconnect between the control strategies, even in residential properties, and the actual burden of human cases is very difficult to resolve. And And I do think I absolutely agree that a large part of the story is that, it's just a really small area that you're still covering. You're not, and another one of my research interests that's really been developing is like the differences in how people interact with the landscape in public, or excuse me, in urbanized environments versus rural environments. Because I suspect that how people are using the woods and interacting with the woods is quite different, depending on like what region you're in. And so in a lot of the rural landscapes, like where I am, where there's really high Lyme disease incidence, I think there's a need to better understand like how exactly are people interacting with the landscape to begin with, as a means to target the tick control efforts or the would-be tick control efforts.
And I guess that kind of goes too in terms of how you use the landscape in your backyard versus what you're doing, activities that you're doing when you're hiking versus all the kind of things you're doing back. So I mean, I appreciate that, Ali, and but I like the notion of the dual messaging in an area where stay on the trail for multiple reasons.
And that's where we're kind of going with the invasive plants as well. Manage the invasive plants for multiple reasons. I like these kind of like win-wins that you can position because they can lead to like positive behavioral spillovers. Andrew?
Super quickly, just following up on land use patterns in residential versus public lands and all that. The meta-analysis that the Osfeld group did, they had to make a lot of really simplifying assumptions about the way landscapes were classified in the original papers to even put them in the right category. And then they also made a lot of simplifying assumptions about how they wanted to analyze it. So I worry a little bit that there's like a buffer zone that's not necessarily the ecotone, but there's some land usage space that's between your residence and public lands per se. That it's there's no obvious descriptor for it. And so anyway, I just that meta-analyses are always the original. So I'm not sure.
No, I agree. I do not disagree with you at all. And I think that there's a lot of like very interesting work going on, including led by your lab and by Maria's lab, and dealing with how exactly are people dealing with the, interacting with the landscape. That'll bring a lot of clarity. I've been thinking about trying to do a study on how people interact with the landscape here as well. But the way that I haven't been thinking about approaching it using like GPS devices, like a lot of the other studies have, because I think people would just not do it here. But there are techniques that you can use to like very specifically elicit people's time use and like help them recall their time use. And so I'm thinking if I can get a sense, especially I'm interested in this urban rural divide, and how people are interacting with the landscape, how much time are they spending in these different types of habitats, even if we're not documenting, like, did they encounter a tick? Where exactly did they encounter a tick? You know how they're spending their time distribution outdoors, that can help maybe give some insights into what the high risk areas might be. And so that's something that I'm interested in approaching too. That may be the subject for my R15 little project after the new year. Yep. Well, thanks so much, everyone. Just being mindful of the time. I imagine we've got a break soon, but I really appreciate all the feedback and the questions and comments. I'm really eager to follow up on the discussions. Please feel free to send me an email. This has been great. This is the first time I spoke about this research like purely with other people working in vector-borne disease. And so it's really interesting to see the different types of feedback I've gotten from different places.
Thank you, Ali, for the presentation. All right. Have a nice day, everybody.